so many different types of changes that can exist. Then we need to understand, what does that change actually mean? Now, when it comes to genetic testing, not all genetic testing is equal. This is so different from going to your GP and getting your iron levels checked, or from going to the GP and checking in pregnancy and the level of HCG in the blood, or anything like that, where, yes, genetic testing can be a simple blood test in terms of what you experience at the pathology collection place. But the different types of genetic testing vary significantly. First of all, there's two very broad categories of genetic testing, which isn't up here on the slide, but this is just to help you figure out. Now, people might be pursuing genetic testing for two different reasons. One is because they've got something going on and they're trying to understand or get a diagnosis. So that type of genetic testing is called diagnostic genetic testing. You're affected, something's going on, you're trying to get your diagnosis. The other type of genetic testing that's quite common is your brother's got a diagnosis, your child, your mother, your father, your auntie, a relative related to you by blood has already got a genetic diagnosis, and you want to know, what does that mean for me? Do I have it too? So just to clarify before I go further, that type of genetic testing is called predictive genetic testing. That is, we're telling the lab, of those 5,000 volumes of Harry Potter, right? We're basically saying to the lab, hey, this person's sister, if you go to volume number 4,236, turn to chapter 7, line number 13, and read that sentence. Can you tell me if that sentence says this? So that is really a simple, straightforward genetic test that people can access easily through a clinical genetic service on one condition. That condition is that their relative, whoever is connected to them by blood, has a clinical genetic report detailing what change has been found. So if that already exists in someone's family and they've had that testing and they've got that report, you can go to a clinical genetic service and say, hey, can you check me for it too? Okay, so that's predictive genetic testing. That is fairly easy to access through your state genetic service. The rest of everything I'm talking about is more what we're hearing on Helpline. It's the people that have got this, clinical mito diagnosis or suspected mito, and they're trying to get genetic testing. So the rest of what I'm mentioning here is for diagnostic genetic testing when you're looking for the answer. Okay. Now, as David mentioned, just pause and think for a sec about those 5,000 books of Harry Potter and all of those different changes that can happen. It's really complex looking for a change. And so there's 4 kind of different groups or categories of genetic testing. Because this language is complex and it's tricky and confusing, it's totally understandable if someone says, I want to get a genetic test. And you might Google and see, well, what sort of things are genetic tests? And lots of different things claim to be a genetic test or will describe themselves as a genetic test for a cost. So the 4 categories that I've popped on the screen, there's a clinical genetic test. That means you're going to a clinical genetic service. It could be a public clinical service or a private clinical service. Okay. I'm going to go into further detail on this one, so I'm just going to park that thought for a moment there. The key thing about clinical is this is surrounded by medical professionals, allied health professionals, working on you, your individual, your symptoms to get your diagnosis and your answer. Okay? Research. Research, that's the field that David spends a lot of time in. Research genetic testing is fantastic, right? Often there is funding in the research field that you just can't access in the clinical field. Often there is technology or types of testing available in the research that you can't access with clinical. But any research study, research program is always designed with a hypothesis in mind, that the researchers are trying to answer a question and they're looking in people to try and answer this question. The answer they're looking for might not actually be the same answer that you're looking for, okay? So it's important to understand, what are they looking for? What are they going to tell me? What are they not going to tell me? Now, we're very fortunate in Australia with very rigorous ethical guidelines on research, that researchers and their ethics committees are brilliant at talking to people about, what are we looking for? What are we going to tell you? What are we not going to tell you? What does it mean? So you can be comforted knowing that if you participate in research, even if you don't understand initially, along that process and before you agree to take part, you will understand what it is that you're getting tested, okay? Also, it's not considered a clinical diagnostic test if you have a result from a research study. And there's every chance that if they find something, it's still a quality lab, it's a reliable result, but there's every chance that they will want to repeat it in a clinical setting to confirm the result. So the most important point here is that research is different to a clinical genetic test, but it is reliable and quality and excellent. You just need to understand what it is that you're being offered through research. Consumer-led, now the official name, consumer-led physician audit, and direct-to-consumer, these kind of go together, but also have some key differences in that this is what's likely to come up when you Google search, when you're looking online, shared on Facebook, other social media. It's when you can pay without accessing a clinical genetic service for various different genetic testing. And this is where we need to be cautious, okay? A consumer-led physician audit will usually be a quality laboratory looking for changes, and there will be a specialist involved somewhere along the line. But it's confusing. It's really confusing with their predatory marketing, with their terms in there about 30 times read and clinical grade this, and this is what we can offer, and we can sequence your whole genome for $300. David, I don't know if it's possible to sequence a whole genome effectively for $300. And my word here is, be cautious. Be cautious about what it is they're trying to sell you. It's understandable when someone is desperate for an answer and desperate for diagnosis and feels this barrier to accessing clinical genetic testing, that they might find that the solution lies online with a test. I find even with 5 years of university training on genetics, I'm overwhelmed and bamboozled with some of the claims and some of what they're promising that they can offer. My single biggest tip would be this. If you find yourself looking online at any sort of genetic testing that you can pay for, find out if you can access pre-test genetic counsellor. Because if that company or laboratory has genetic counsellors on their team that can help you understand if that test you want to pay for is actually relevant and appropriate for you, it could very well be worth pursuing. If they don't offer any pre-test counselling until you've paid your money and then want you to subscribe and give you bonuses if someone else pays after you, steer clear. It's not going to give you the answer that you're wanting. So there's very important differences in terms of the technology they use, the accreditation of their labs. David also spoke about the variant curation. So some of these labs, that they're just looking for changes that they already know. They're not looking at anything new. They're just looking at what's common. They might only be looking at the points and nothing about the deletions. So there's a huge differences in what they're looking for, how they interpret it, and how they report it. So the clinical there gets the big gold star, right? Speak to your, as everything else, speak with your medical team about if you can access clinical genetic testing if you haven't already. If you accessed it more than a few years ago and had uncertainty, ask if you can access it again. We're often getting asked, how do we find a clinical genetic service? HGSA is the only thing you need to remember. First, ring helpline, ask us, right? Human Genetics Society of Australia has a list of every different clinical genetic service in Australia, both public and private. Accessing clinical genetic testing is not as simple as, can you ask a GP for a referral and book an appointment and go? There is a step and a stage to go through every step of the way. But ultimately having a well-described phenotype, that wonderful word, which is what are the symptoms, what's been done, what have the specialists seen in me already, that is the critically important step to accessing clinical genetic testing. Oh yeah, speak with your medical team.